Welcome to the Fight Cancer with Dr. Prasad podcast, your source for the latest, most reliable, and research based information about cancers and their treatments. Every day, I get cancer patients in my OPD asking so many questions about cancers, why I'm having cancer, how do we treat it, and I realize that there is such a dearth of information about cancers, especially in the Indian context. There's a lot of information online about cancers, but most of it is either false or is not accurate. And hence, I decided finally to start this podcast, Fight Cancer. And I realized that the best way to help my patients is to put out the latest and most reliable information in front of you. And to do that, I'm going to get experts not only from India, but across the globe to come and join me on this podcast and give you the latest information. So today I'm going to start with the most basic form of what is cancer and why do we get cancer. And in the following episodes, we are going to go into very much detail of each of this aspect. We're also going to look at what's happening on research, which are the latest papers getting published, what is the new treatment that is coming up to tackle cancer. And we're going to get that information also on this podcast, but not in a very sort of a complicated, medical terms. But we're going to digest it, make it simple for a non-medical person to understand so that you can benefit from what is happening. This podcast is actually a bridge between the oncologists and the patients, where we start speaking the same language. So let's delve into what is cancer. A lot of times I get asked questions like, Doctor, where did I get this infection from? How did this bug get into my body? How do I get rid of this cancer infection? Now, cancer is not an infection. It is an abnormal and uncontrolled growth of your own body cells. Now, you may ask, why does this happen? Our body is composed of millions and millions of cells, all sorts of cells, including your hair, your brain, your muscles, your skin, and everything. All these cells are continuously dividing to keep you healthy and active. Now, when these divisions are happening, sometimes something goes wrong. It's like having a car. You buy a new car, first 5 years, no problem. 10 years, some problems come up and you have to repair. By 15 years, you have some major work that needs. Our body is also similar to that. As we age, the chance that something will go wrong with our body increases. Now, our body is designed so beautifully by nature that if something does go wrong, the body will pick it up and identify that there is a problem and try to contain it, try to kill that problem. So if there are some cells which are dividing uncontrollably or looking abnormal, your body itself will try to sort of get rid of those cells. And this process is called as apoptosis. But sometimes even the process of apoptosis goes wrong, or the body is not able to detect that there are some cells which are abnormal. And that is when a tumor is formed. Not all tumors are cancerous. Now, this is going to get slightly confusing for some people. I'm saying that there is a tumor and it is not a cancer. So there are certain tumors which are non-cancerous, which means they don't grow uncontrollably. So for example, one of the common tumors that we see is a small lump in the breast that women have. It's called a fibroadenoma. It's an abnormal growth, but it's not uncontrolled. So it's not cancerous. If you just leave it there, nothing will happen. Say, for example, a tumor like a pituitary adenoma in the brain. It's an abnormal growth, but it's not uncontrolled. It's not going to cause problems and it's not going to kill the patient. So those are called as benign tumors. And in this podcast, we are sort of not going to focus on those tumors. We are going to focus on tumors which are cancerous, or in a technical language, what we call as malignant. Okay. Now, these are the cancers we are going to focus on. But let's sort of talk about, why do we get cancers? What are the causes for getting cancers? Now, the first cause that we, is very often we see this cause is all the addictions to bad substances such as tobacco, alcohol. Now, tobacco and alcohol are proven to be one of the significant causes of cancers, especially when they're taken together. That's really bad. What these substances do is that they attack or sort of change the normal cells in our body and make them abnormal, and that abnormality then eventually leads to formation of cancers. So for example, if somebody is chewing tobacco, they're going to keep that tobacco in their mouth, and the cells around that area are going to get continuously irritated by those toxins. And at some point, those cells are going to start dividing uncontrollably, forming an oral cancer or a tongue cancer or a cheek cancer. So that is one way that cancers form. Alcohol, when added to somebody who's consuming tobacco, increases that risk even more. So what are the common cancers that we see because of tobacco and alcohol? You have oral, mouth cancers, you have throat cancers, food pipe cancers, lung cancers, even to a certain extent breast cancers, are urinary bladder cancers, or where the urine is collected, urine bag cancers, and there's so many other cancers which can form because of tobacco and alcohol. Okay. The other common cause of cancers is our lifestyle and diet and exercise schedules. Now, if you look at our diet, it has substantially changed over the last few decades. We are not eating the food that our parents were eating, say, 20, 30 years ago, or our grandparents were eating, say, 40, 50 years ago. We are having pizzas, we are having pastas, we are having colas, we are having ice creams, we are having a lot of sweets. We still don't have a very compelling evidence to link particular diet to particular types of cancers, but there are some correlations, such as diet which is highly processed. So, all your highly processed food that you can buy and eat. Certain diets, which include very spicy food, can cause cancers such as stomach cancer, cancers of your food pipe. Then there are diets which are very high in meats, but very low in fiber content, can cause certain cancers like intestinal cancers. So diet can play a significant role in formation of cancer, and hence it is important that we maintain a very healthy diet. Exercise has also shown to be significant in reducing the risk of cancer. Now, if you look at obesity, which has become a huge problem. If you look at US, they're almost saying that there's an endemic, of obesity. A large proportion of people are overweight. And we are seeing that in India also, because our diet has changed. Even we have children which are, overweight now. There are certain types of cancers which are associated with obesity. So you have breast cancer, uterine cancers, and many other, cancers which are associated with obesity. So weight management is also an important part of keeping yourself free from cancer. Okay. There are certain infections which can cause cancer. Now, at the beginning I said cancer is not an infection, right? So don't get confused with that. Now I'm saying that you can get a certain infections which may lead to formation of cancer. The commonest infection that we see is called as a human papilloma virus infection, or HPV infection. Now, this infection is actually very common. Almost around 70% of the adults at some point in their lifestyle will get this infection. Most of us get that infection, and the infection is cleared out. It is also a sexually transmitted infection. Some of us will not be able to get rid of that virus. Some of us will have a chronic infection, which may lead to formation of cancer. The common cancer which is associated with HPV infection is cervical cancer, or cancer of the opening of the womb. Now, this cancer is one of the commonest cancers in India, caused by a simple infection. And this can be prevented by a vaccine. Now, this vaccine has been available for a long time. And now the government of India also sort of is trying to incorporate into our vaccination schedule. So this vaccine will prevent the HPV infection, and hence in turn significantly reduce the formation of cervical cancer. The key is that this vaccine needs to be given early in life, so age of around 9 to 14 years. It can be given up to the age of 26 also, but the ideal age is 9 to 14 years of age. Okay. So we spoke about various aspects of, addictions. We spoke about diet. We spoke about obesity. We spoke about exercise. We spoke about lifestyle and all these infections also. But there is one important cause that we are getting cancers now, which is something which most people don't even think about. And that is our aging. When we got independence, the average life expectancy was around 37 to 38 years of age. Right now, the average life expectancy for women in India is 69 and for men is 67, and it is increasing now because of improvement in our lifestyle, in terms of reducing the chances of various infections or communicable diseases, and also because of availability and access to better medical care. So we are surviving till longer time. And as I gave you the metaphor of a car, our body is, since it is aging, there is a increased risk of developing cancer. And cancers like prostate cancer, for example, is a cancer of aging men. If you die at an early age, you're not going to get prostate cancer. But if you survive till you're 75, 80, 90 years of age, there's a high chance that you will get that prostate cancer. So the mere fact of being alive puts you at a slightly higher risk of developing cancers. And you may ask, doctor, what are you talking about? Do you want me to die early? Of course not. I want you to live a very healthy life for a long time. And in the following episodes, we are going to get into details of how do we do that. So the best way to detect the cancers is early detection. We have to catch it when it is very small. And even a better way is to prevent the cancers. So let's talk first about how do we detect these cancers early. So anytime anybody feels any abnormal growth, so if you feel a lump in the breast or some lump or bumps in your neck or any other part of the body or any other symptom, such as some, you feel that I'm losing weight or I have severe headaches or I have some pains and aches which are not going away, then that's the time you need to meet your doctor and find out what is exactly happening in your body. Is there a problem? Okay, so early detection of tumors is very important. And we're going to do an episode on how do we detect these cancers early? What are the scans we can do? What are the tests we can do? That's going to be a whole different conversation by itself. Let's talk a little bit about the treatment now. Now, when we talk about treatment of cancers, a lot of people are scared. They're almost as scared of the treatment as much as they're scared of the disease itself, cancer itself. And rightfully so, because if you look at the history, the treatments have been very toxic. One of the first treatment for cancers that was developed was surgery, because back in 150, 200 years ago, we didn't have any other options. So if you see a lump, the doctors would try to remove that lump. And even the surgeries were very high risk, because in those days, we did not have proper sterilization methods, or there was not even awareness that we need to keep things sterile. So the surgeries were very difficult and very morbid. Over a period of time, that has changed. From a very grotesque and morbid surgeries, we have now moved on to very, very refined and very sort of precise surgeries. And even we have now robotic surgeries. And it sounds really fancy, right? A robot doing surgery. And again, we'll talk about what sort of robots are these? How do they do it? What do the doctors do in these surgeries? So surgeries have evolved. And there are certain cancers where surgery, it forms a cornerstone of the treatment. So for example, if you look at oral cancers, where your tongue cancer, a cheek cancer, or a breast cancer, where surgery forms a mainstay of treatment. Then the other form of therapy, which evolved, say around 120 years ago, what we call as radiotherapy or X-ray therapy. And the story how radiotherapy evolved is also very interesting, how the X-rays were discovered and how the radioactivity was discovered and how was it used to suddenly treat cancers. And the journey is very exciting. And I'm going to do an episode purely on radiotherapy and its history because it's fascinating, and also because I'm a radiation oncologist, so I'm more passionate about it. So radiotherapy has also evolved from let's give some radiation and see what happens to let me give radiation to an absolute pinpoint position and protect the other surrounding structures and kill that cancer. So it has evolved quite a lot. It has become very specific and pinpoint. The other therapies that involved from 1960s onwards is what we call as chemotherapy. Now, these are generally injections and sometimes are tablets also, but they are sort of chemicals which we inject into the body, and they go and attack the cancer cells. And there are hundreds of chemotherapy drugs, and each of them acts in a different way. They will attack different types of cancers, they will attack them in a different way, and they will have not only effect on the cancer cells, but it will also have impact on some of the normal body cells. Hence, there are some side effects of chemotherapy as well. But that has also changed. Now, chemotherapy is also becoming more specific. We are understanding which chemotherapy drugs are going to work in which type of cancers. We also have now better drugs to protect ourselves from the side effects of chemotherapy. So, give you a simple example. One of the side effects, one of the commonest drugs that we use is cisplatin. And one of the big side effects of cisplatin was intense vomiting. Patients would die of vomiting. It was that bad. And now we have a very simple drug. It's just a tablet called ondansetron. You take that and the patient doesn't have vomiting at all. So that particular side effect, which was such a dreaded side effect that patients would sometimes die of it, is taken care of. So chemotherapy has also evolved. Then we have the latest, sort of treatment options such as targeted therapy and immunotherapy. Targeted therapy sort of started coming up 20, 30 years ago, and now it has also evolved. To give you an example, when I started my oncology training in 2001, lung cancer was such a dreaded cancer. A diagnosis of lung cancer was like, okay, this patient is not going to sort of make it for a long time. If it was a stage 4 lung cancer, then we would say maybe 3 months, 4 months, maximum 6 months if the patient is lucky. Now, because of the targeted therapy, things have changed so much that a stage 4 lung cancer could survive for years on just a simple tablet if they are EGFR positive. And we'll, again, as I said, go into the details of that later. So just a tablet, patient doesn't have to take any other treatment. Take a tablet and lead a healthy life. Then immunotherapy has become now a cornerstone in oncology. Immunotherapy is where we use our own body's immune system to sort of tackle the cancers by giving some drugs from outside. And that is a very, very exciting development that is happening in oncology right now. A lot of new drugs are coming up and a lot of new indications. So we are understanding in which cancers immunotherapy is going to work better. So overall, while we see that the incidence or the number of people getting cancers is increasing, unfortunately, the treatments are also improving. So we have to focus on how do we protect ourselves from cancers, or if we do get cancer, how do we detect it at an early stage? And this podcast is going to help you to understand this process better, to help you to protect yourself, and not just yourself, but your family also better. So to summarize, how do we protect ourselves from cancer is by leading a healthy lifestyle, good amount of exercise, staying away from addictions, a good healthy diet. Okay, I like the Indian diet, which is what we call as a square diet, a fair proportion of carbohydrates, proteins, fats, and other dietary components such as fibers. So if we do that and prevent obesity, that's a great way to lead life into cancer-free life. But also we need to understand our own risk of cancer. Say for example, if you had been a smoker and now you've given up, you've made the right choice. You need to understand that even you give up smoking, for some years you need to be a little careful. Or there is a family history of cancers. So you need to understand that there is a chance that you may develop this cancer because of the family history. So you need to go to the doctors and start understanding what is your risk of developing cancer and maybe do some screening tests at a regular interval. So these are some of the tricks that we need to follow to keep ourselves cancer-free. Now, in the coming episodes, we are going to go into great details of each of these components. We are also going to go and look at what is the research saying to us so that you have most reliable, most latest, and evidence-based information on this podcast. Thank you for joining us today. I hope you find today's episode informative. Please feel free to ask your questions in the comment section and we'll get back to you with the correct information. Please do like and subscribe to the channel, but more importantly, Share this information with people you care about. Join me in this fight against cancer.